Whether you are new to Medicare or perhaps you've been on Medicare a few years and maybe you've got one of those Medicare Advantage plans and you found out it wasn't as great as they told you it would be, getting all these out-of-pocket expenses, well, you might be asking yourself, what are the best Medicare supplement plans? Now, that depends. What might be best for one person isn't necessarily best for another. I'm Russell Noga with Medisupps.com. I've been helping people for over 12 years with their Medicare supplement insurance, and I want to help you as well. Now, today I'm going to be talking about the best Medicare supplement plans, really just the two most popular plans, and help you decide which one is best for you, because that's all that matters. Stick around. Now, as I've mentioned, we've been doing this a long time. Along with my top agent, Diana Firth, we have seen a lot of changes throughout the years, and we've helped a lot of people with their rate increases. Choosing the right Medigap agent is one of the most important decisions you can make, and our service is entirely free. So go ahead and jot down our phone number, grab a pen and paper, because I want you to take notes throughout this as well. Our phone number is 1-888-891-0229. Also, put your question down below, drop a comment. We will answer it and we will help you throughout this entire process. I'll first discuss why you even might need a Medicare supplement plan in the first place. And that is because with Medicare Part A and B, that's called Original Medicare, they don't cover all of your medical bills. Now, what they don't cover are called gaps. So you may have heard the term Medigap. That's actually the same thing as a Medicare supplement. Medigap helps pay the deductibles, copays, and coinsurance that Medicare Part A and Part B do not cover. Now, Part A covers hospitalization and Part B covers doctor services. So hopefully you won't be using Part A too much and hopefully not even Part B. However, a Medicare supplement plan with that in place, you can go to any doctor, specialist, or hospital anywhere in the country that takes Medicare. Unlike some Medicare Advantage plans, when they have a network, you have the freedom to go anywhere you want. And with a Medigap plan, you can get most of your bills paid for you. So there are a variety of Medicare supplement plans available, and they are lettered. Just to make it more confusing with alphabet soup, you've got the parts of Medicare A and B, but Medicare supplement plans are in letters, so they're Medicare Supplement Plan G or Plan N. So we'll put those parts aside for now and just focus on these. Now, you may have seen the Medicare supplement plans chart, all those check marks and all the benefits on the side. I like to make things easy, and again, having done this for so long, there really are two different plans that most people go with. There are a few others that have their uses. However, chances are you're going to be enrolling in one of these two plans, and that is Medicare Plan G or Medicare Plan N. So let's start with Medicare Plan G. Now, again, Part A and Part B cover hospitalization as well as doctor services with gaps in both. You'll have a deductible to pay. If you go into the hospital, you'll have a deductible to pay to even before Medicare starts paying any of your bills. Then you've got 20% coinsurance on every medical bill thereafter. Well, it's very easy just to simply tell you what Medicare Plan G pays and what it doesn't, which is everything except the Medicare Part B deductible. Now, what is that? Well, a deductible is the amount of money, of course, for people who just might not know, amount of money that you pay prior to your insurance company paying. In this case, there is what's called the Medicare Part B deductible, which Part B, of course, is doctor services. So when you go to the doctor in January, you need to pay a certain amount prior to Medicare paying its amount. Now, we're in 2021, and that deductible is $203. This is going to go up as it does every year, a couple dollars. So in 2022, this still applies. You've got that same deductible, and it might be $210 or so. We'll see what that is. Once you meet that deductible, however, pay that first $203 of your medical bills, Medicare will come in and pay the difference 100% with a Plan G, up to no limit. Now, that deductible is an annual deductible. That's not each occurrence. So once you meet that deductible for the calendar year, you are paid. And then with Plan G, you get 100% coverage on your medical bills up to no limit for the rest of the calendar year. Now, that's great coverage with Medicare Plan G, and that's why it is the most popular plan. But there's another plan that is rising in popularity, and for good reason, and that is Medicare Plan N. What are the differences between the two? Well, Medicare Plan N has lower premiums, that's for sure, but I'll get to that in a moment. The difference in benefits, on Plan N, you still pay that Part B deductible just like you did on Plan G. However, with Plan N, you might have a small copay per doctor's visit for each visit throughout the calendar year. Now, that copay will never be more than $20. Could be less or could be $0. It just depends on what you go for and how they code your visit. But it will never be more than the $20. Now, very popular these days, obviously, telehealth visits because of COVID. Well, doctors are probably realizing they should have been doing those all along. Good news, though, on Plan N, you don't get charged a $20 copay for those. Now, another thing on Plan N is if you visit the emergency room and you're not admitted to the hospital, there'll be a $50 copay. And that's just to keep people from going to the emergency room for non-emergencies. However, if that happens to you, it's a good thing you're not admitted. It means you were well enough to go back home. It's a $50 copay. Plan G does not have that. One other thing on Plan N is what's called Medicare Part B excess charges. Now, doctors can either accept the assigned rates from Medicare and not charge extra, or for their entire practice can say they don't want to accept assignment and charge up to 15% extra, what are called Medicare Part B excess charges. Great news is 96% of all doctors estimated actually don't charge excess charges. Chances are your doctor does not. Just give him or her a call to find out. And even if in the rare case you did see an excess charge, it would probably be quite low. And even some of the major insurance carriers, when they run the data and they do their statistics, find that 99% of their claims don't even have excess charges. So those are the big differences with Plan N. Now, there are also states that are not allowed to charge excess charges. That list is up here now. So if you're in one of those states, we should definitely be looking at Plan N for you. Again, as I mentioned, Plan N has lower premiums than Plan G, and big factor here is they also have lower rate increases. Now, why is that? Well, if you have a plan that has more out-of-pocket expenses, people are going to use it more responsibly. That's just human behavior. Plan N, due to that fact, does have lower rate increases that we're seeing. So for long term, maybe you're just coming out of Medicare, perhaps you've got a condition that you feel maybe a decline throughout the years. Plan N is a great place to start because you'll start with lower premiums and have lower rate increases. We could check those rates for you. So you can either visit Medisupps.com, my website, where I'm the only one out there who's providing quotes for people free of charge. Everything we do is free of charge. Or you can call us direct, as I mentioned, at 1-888-891-0229. So while those are probably the best plans for most people, they are the two most popular. We can help you see which one's going to fit your situation the best, and we're happy to help. So give us a call today, and thanks for watching.